What if I told you there's one simple thing that could prevent bladder problems, boost your mood, strengthen your pelvic floor, and help you sleep better, but 80% of women over 60 have completely stopped doing it? And what if your doctor has never mentioned it because they assume you're past that stage of life? Stay with me, because what you're about to learn could change how you age from the inside out. Here's what I'm seeing in my practice every single day: women in their 60s, 70s, and 80s coming to me with what they think are separate, unrelated problems. Bladder leakage that's keeping them home from social events. Sleep issues that leave them exhausted. Mood changes that make them feel like strangers to themselves. Pelvic pain that doctors dismiss as normal aging. But here's what shocked me after 30 years of treating women: these aren't separate issues at all. They're all connected to one thing most women have been taught to abandon after menopause. And the medical community has been silent about it for decades. Let me paint you a picture that might feel familiar. You're 65, maybe 70. You've raised your family, maybe lost your partner, certainly watched your body change in ways nobody prepared you for. Somewhere along the way, you started feeling invisible. Not just to others, but to yourself. You catch glimpses of yourself in mirrors and think, who is that woman? You avoid certain activities not because you can't do them, but because you're worried about embarrassing accidents. You sleep poorly. Little things irritate you more than they used to. You feel disconnected from your own body, like you're living from the neck up. Your doctor runs tests. Everything comes back normal for your age. But you know something's missing. You just can't put your finger on what. Here's what nobody told you: that missing piece might be simpler than you think. And more important than anyone realized. The truth is, somewhere along the way, our culture decided that women have an expiration date on intimacy. That after menopause, after your childbearing years, that part of you should quietly fade away. But your body didn't get that memo. What medical research is now showing us is that intimate self-care, yes, including self-pleasure, isn't just about sexuality. It's about circulation, hormone balance, muscle strength, and neurological health. When women completely abandon this aspect of self-care, their bodies don't just pause. They begin to change in ways that affect everything from bladder control to emotional resilience. Dr. Sarah Chan from Johns Hopkins put it perfectly in a recent study. We tell women to exercise their hearts, their minds, their muscles, but we've ignored an entire system that needs attention to stay healthy. And the consequences of that silence are showing up in doctors' offices everywhere. Now we're going to dive into the 4 silent consequences. Consequence number 1, the vanishing act. Let me start with what happens to your most intimate tissues when they're completely ignored. Think about any muscle in your body. Your arms, your legs, your back. What happens when you don't use them for months? They weaken. They lose tone. They shrink. The same thing happens to your vaginal walls and clitoral tissues. These areas are incredibly rich in blood vessels and nerve endings, but they need stimulation to stay healthy. Without regular blood flow from arousal, these tissues can become thin, dry, and less sensitive. It's called vaginal atrophy, and it affects up to 60% of postmenopausal women. But here's what doctors don't always explain: this isn't just about discomfort during sex. This affects how you feel sitting, walking, even wearing certain clothes. I had a patient, Linda, age 72, who came to me in tears. She said, "Doctor, I feel like my body is disappearing from the inside out." She wasn't wrong. Her tissues had become so thin and sensitive that normal activities had become painful. The tragedy? This is largely preventable. With gentle, regular stimulation, even just a few minutes twice a week, most women can maintain healthy tissue function well into their 80s and beyond. But it gets worse. Consequence number 2, the hormone hurricane. Most women know that menopause changes your hormones. What they don't know is that intimate activity, including self-pleasure, is one of the most powerful hormone regulators your body has. When you experience arousal and release, your brain releases a cocktail of beneficial chemicals: oxytocin for calm and connection, dopamine for mood and motivation, endorphins for pain relief and happiness. This isn't just feel-good science. These are the same hormones that regulate sleep, manage stress, and maintain emotional balance. Now imagine going years without triggering that natural pharmacy in your brain. I'll never forget Maria, a 68-year-old retired nurse who came to me struggling with anxiety and insomnia. She'd tried everything: meditation, medication, therapy. Nothing worked consistently. When we talked about her complete health picture, she revealed she hadn't been intimate with herself or anyone else in over 5 years. She thought that chapter of her life was simply over. We worked on gradually reintroducing gentle self-care practices. Within 6 weeks, her sleep improved. When it weakens, you start experiencing leaks, urgency, even pelvic organ prolapse. During climax, these muscles contract rhythmically. It's like the perfect workout, perfectly timed, with no equipment needed. But when women abandon intimacy completely, they lose this natural strengthening mechanism. Margaret, age 76, came to me because she'd stopped leaving her house. Every sneeze, every laugh, every sudden movement resulted in leakage. She was wearing heavy-duty pads daily and had canceled a trip to see her grandchildren. After examining her, I realized her pelvic floor had weakened significantly, not from age alone, but from years of disuse. We created a gentle program combining traditional pelvic floor exercises with gradual reintroduction of intimate self-care. The natural muscle contractions from arousal, combined with mindful strengthening exercises, transformed her confidence. 6 months later, she sent me a postcard from her trip to see those grandchildren. The point isn't that everyone needs to have orgasms to stay healthy. The point is that your body has natural mechanisms to maintain itself, but only if you use them. And there's one more consequence that might be the most important of all. Consequence number 4, the identity erosion. This is the consequence nobody talks about, but it might be the most devastating. When women completely disconnect from their intimate selves, they don't just lose physical function. They lose a piece of their identity. I've heard variations of the same story hundreds of times. I don't feel like a woman anymore. I feel invisible. I don't know who I am. This isn't vanity. This isn't about looking young. This is about feeling alive in your own skin. Touch, especially intimate touch, sends powerful signals to your brain about self-worth, vitality, and identity. When that input disappears completely, many women begin to feel like they're fading from their own lives. Research from the Cleveland Clinic shows that women who maintain some form of intimate connection, whether with a partner or themselves, report higher life satisfaction, better cognitive function, and stronger sense of identity as they age. But here's what gives me hope. This isn't irreversible. Your body retains its capacity for response, for pleasure, for connection throughout your entire life. The question is, are you willing to reclaim it? Now, before you panic thinking you need to completely overhaul your life, let me be clear. Small, gentle changes can create profound improvements. Step 1. Restart your circulation. Consider gentle massage of your lower abdomen and inner thighs. This stimulates blood flow to the entire pelvic region. The goal isn't arousal at this stage, it's simply reawakening awareness and circulation. Step 2. Rebuild your foundation. Your pelvic floor needs attention, whether through traditional exercises or natural stimulation. If you're comfortable with Kegel exercises, start there. Gently contract your pelvic muscles as if stopping urine flow. Hold for 3 to 5 seconds, release. 10 repetitions, 3 times daily. But here's what most people don't know. Deep breathing while doing this is crucial. Inhale to relax, exhale to contract. Your pelvic floor works best when it's part of a coordinated system. If you're ready to explore gentle self-touch, start slowly. Use a good quality, body-safe lubricant. Focus on comfort and curiosity, not performance. Even 5 to 10 minutes twice a week can maintain circulation and muscle tone. Step 3. Reclaim your identity. This isn't just about physical health. It's about psychological wellness. Start by changing how you talk to yourself. Instead of, "I'm too old for this," try, "I'm honoring my body's needs." Create privacy and comfort. This isn't something to rush through or feel ashamed about. You deserve time and space for self-care. Pay attention to how you feel afterward. Many women report better sleep, improved mood, and increased confidence. Consider talking to someone, a therapist, a trusted friend, even your doctor. Breaking the silence around this topic can be incredibly healing. Step 4. The maintenance plan. Once you've re-established connection, consistency is key. Aim for some form of intimate self-care 2 to 3 times per week. This might be gentle touch, focused breathing, warm baths, or more direct stimulation, whatever feels right for you. Continue with pelvic floor exercises. Strong muscles support everything from posture to bladder control. Regular use of vaginal moisturizers helps maintain tissue health. Pay attention to your overall wellness. Better sleep, improved mood, increased confidence. These are all signs that your approach is working. Remember, this isn't about performance or meeting anyone else's expectations. This is about maintaining your health, your vitality, and your sense of self. Here's what I've observed in my practice over 3 decades. Women who maintain some form of intimate self-care don't just experience better physical health. That's the difference between surviving aging and thriving through it. I know some of you might be thinking, this isn't for me. I'm past all that. It feels wrong somehow. Let me address this directly. You're not past anything. You're not too old. You're not inappropriate for wanting to feel good in your own skin. Every day, you make choices about your health. You eat well to nourish your heart. You exercise to strengthen your bones. You take vitamins to support your immune system. This is the same thing. You're making a choice to support your pelvic health, your hormonal balance, your emotional wellness, and your sense of vitality. The shame you might feel isn't yours. It's generations of messages that told women to disappear after menopause. But you don't have to follow that script. You have permission to feel good. You have permission to prioritize your pleasure. You have permission to age with vitality instead of resignation. Here's exactly what you can do starting today. Week 1 to 2, awareness building. Take longer, more mindful baths. Use vaginal moisturizer 3 times this week. Practice deep breathing with hand on lower abdomen. Notice your body without judgment. Week 3 to 4, gentle reactivation. Add light abdominal and inner thigh massage to your routine. Begin basic Kegel exercises, 10 reps, 3 times daily. Explore gentle self-touch if comfortable. Continue moisturizing routine. Week 5 to 6, integration. Aim for intimate self-care 2 to 3 times per week. Focus on what feels good, not what you think should work. Track changes in sleep, mood, and physical comfort. Consider quality lubricant if exploring more direct touch. Week 7 to 8, personalization. Adapt the routine to what works for your body and comfort level. Consider talking to your doctor about vaginal estrogen if dryness persists. Notice improvements in confidence and overall wellness. Share your experience with trusted friends if appropriate. Ongoing maintenance. Consistent self-care 2 to 3 times weekly. Regular pelvic floor exercises. Continued vaginal moisturizing. Annual discussions with your healthcare provider. Remember, this is self-care, not performance. There's no right or wrong way to do this, only what feels respectful and beneficial for your body. What we're really talking about here isn't just physical health, it's the right to age with dignity, vitality, and wholeness. For too long, women have been told that after menopause, after their useful years, they should quietly fade into the background. That their bodies are You're choosing to age actively rather than passively. And in a world that often treats older women as invisible, that's a radical act of self-respect. Look, I know this isn't the conversation you expected to have today. And I know it might feel uncomfortable, even overwhelming. But here's what I want you to remember. You are not broken. You are not too old. You are not past your prime. Your body has carried you through decades of life, and it deserves to be honored, cared for, and yes, to experience pleasure. The changes we've discussed, the bladder issues, the mood swings, the disconnection from yourself, these aren't inevitable parts of aging. They're often the result of neglecting a fundamental aspect of your health. And that's something you can change. If this conversation resonated with you, if it made you think differently about your body or your health, please hit that like button. It helps me know that this kind of honest, evidence-based information is reaching the women who need it. And if you want more content like this, the health information your doctor might not have time to discuss, but that can genuinely transform how you age, subscribe and turn on notifications. Most importantly, start small. Pick one thing from today's discussion and try it for 2 weeks. Notice how you feel. Trust your body's wisdom. You deserve to feel vibrant, confident, and comfortable in your own skin at every age. And it's never too late to start treating yourself that way. Thanks for trusting me with this important conversation. Here's to your health, your happiness, and your right to thrive at every stage of life.